what we have realized is the application part. So where we used to use it only for the status determination early on, we used to call it a gatekeeper program, where the nurses would review on entry to our organization and then assess them in a fashion of whether they're appropriate for the status that was determined, or do we need to change, and then medically ready for discharge. We continue to do that, but when we do the daily reviews, now we bring that information to our interdisciplinary rounds, so the entire care team is aware of how the patient is progressing. And I'll give you a very simple example, very common case scenario. Say congestive heart disease patient, CHF exacerbation, comes in, needed BiPAP initially, was in the ICU. After 48 hours, improved, now on nasal cannula oxygen, hemodynamically stable. And then sometimes the providers and nurses get lost with so many things for them to do that the patient needs to be transitioned to oral diuretics and start thinking about sending them home. So MCG is that it will kind of trigger the UR nurse or the case management or whoever is doing the review and say, okay, is it time for patient to be transitioned to oral diuretics? Is it time to remove the Foley catheter? Let's try to wean them oxygen, ambulate them. And so we started sharing that information in interdisciplinary rounds. What that has helped is with our length of stay. So the goal everywhere is to improve length of stay. And if you improve the length of stay, you have beds open up for other patients that are flooding in the ED and sitting in the hallway. So that has helped flow and throughput indirectly. And through COVID, our hospital, and when I say our, it's the Wilmington, New Hanover Hospital, has seen I would say about 10% influx in population, and mostly geriatric population, complex, socially complex, medically complex, and we have not been able to keep up with the bed needs, especially with the nursing staff. So that's why flow and throughput has become very important. So where MCG keeps the financial vitality of the organization going because of our right status determination, decreasing denials, overturning peer-to-peers, it's also helping with opening up beds in the hospital and putting the right patient in the right bed and then discharging them to the next right level of care.